President Akufo-Addo has launched a national plan and policy on antimicrobial resistance in Accra.
This is to ensure convergence of action and purpose and minimize efforts in preserving antibiotics to protect the health of all Ghanaians. President Akufo-Addo called for efficient use of antibiotics for its positive effect on human health.
Antimicrobial have been used to prevent and treat microbial infections. Recently, the overuse and ineffective of antibiotics is posing health risk for humans as the parasite and the bacteria have been resisting the medicine. Health experts say antimicrobial resistance, popularly called AMR, is threatening to derail a significant achievement made in the field of infectious disease therapy, animal and crop health, the environment, fisheries and aquaculture. According to the World Health Organization, AMR is an increasingly serious threat to global public health that requires action across all government sectors and society, since without effective use of antibiotics, the success of major surgery and cancer chemotherapy will be compromised. The effect is that the cost of health care for patients with resistant infections is higher than care for patients with non-resistant infections due to longer duration of illness, additional tests and use of more expensive drugs. The launch of the National Action Plan and Policy on Antimicrobial Resistance is to improve awareness and understanding of antimicrobial resistance and action plan to tackle the menace. The policy contains the phenomenon of antimicrobial resistance, which is considered as a threat to public health in the world. The country representative of the World Health Organization, Dr. Owen Laws Kalungwa, promised his organization's continued support in tackling the AMR. The Minister for Health, Mr. Akufo-Addo, said his ministry is prepared to make the policy and action plan work for the good health of the citizenry.
We are moving straight into implementation together with all my colleague ministers as well as all stakeholders. The plan has been costed and all rules defined to ensure we are all working towards the goal of managing resistance to achieve the SDG targets. Initial preliminary estimates through the costing mechanism we used indicates we will need about 21 million to implement the policy over a 5-year period.
President Akufo-Addo said Ghana is well positioned to join in the global effort to fight antimicrobial resistance.
The World Health Assembly has urged all member states to develop and put in place national action plans on antimicrobial resistance, which must be aligned with the objectives of the Global Action Plan launched in May 2015. Today, we're not only launching the National Action Plan, but we're also launching a national policy document. This is truly historic, and I say a big echo to the Ministers for Health, Food and Agriculture, Environment, Science, Technology and Innovation, and Fisheries and Aquaculture Development for the work they have undertaken in ensuring today's launch. The launch of this policy and National Action Plan is a clear indication that we are ready to implement their contents. I'm therefore tasking the SDG Secretariat to ensure their smooth and hitch-free implementation. Additionally, the Minister for Health and the Attorney General are to take the necessary steps to move some of the policy issues into legislation to ensure our public health safety.
President Akufo-Addo urged all Ghanaians to join hands in the implementation of the antimicrobial resistance plan, adding that together we can effect change in the handling and use of antimicrobials.